For my assignment, for the first question, I feel like I'm doing well so far. But then again, it's only the first week of class. I'm trying to just get organized, figure out my priorities, and how to manage my time well. I've also been doing the clinical judgment assignments, which I find help me with repetition. I work as in an ambulatory surgery center. The day of this case, I was working in PACU. The patients come in for procedures, and I had a patient who come in who was diagnosed with MS. The patient came in with his wife at the time. I started doing my preoperative questions with the patient and his wife. The patient seemed to be confused about some of the questions I was asking. He also started to have some tremors to his hands. While documenting a couple of the questions, I looked over at him on the stretcher and noticed he continued to look around the center like he was confused where he was. But he was able to respond appropriately to person, place, and situation. So I notified the anesthesiologist I was working with that day to come and see the patient with me. I asked the wife to step away and asked if the tremors and confusion were his baseline, and she said that it was new for him. She said she was starting to become concerned in the waiting room, but she said she thought maybe it was from being NPO for 6 hours and having to do the colon prep the day before. I ended up hooking up the patient to the vitals and a 3-lead EKG when the anesthesiologist spoke with the patient and his wife. Once I hooked up the patient to the vitals, it was very clear that the patient was in AFib, with no history of this in the past. The patient started slurring his words very shortly after hooking his vitals up. Per his wife, his mother had just passed away from new onset AFib, which was undiagnosed about a month prior. Per anesthesia, I called for an ambulance. We were able to get the patient to the hospital within 10 minutes. We had found out later on that the patient was having a stroke from the undiagnosed AFib, but because of the fast acting of myself and the anesthesiologist, the patient was treated quickly and then ended up with no long-term effects from this. How did this make me feel? Well, I strive under pressure like these situations, so I was calm. I was just trying to do my best for the patient and his wife. I took care of all of the calls and the information that was needed for the ambulance staff while also making sure the patient and his wife remained calm. Understandably, the patient's wife was very afraid he was going to die after what happened with her mother-in-law recently, so I made sure to spend time with her individually as well and explain all I was doing for the patient to get him the treatment that he needed. While the ambulance staff took him, I felt afraid that would have been too late to get the patient treated once we noticed the stroke symptoms. I felt good about being a nurse in this situation because I want to make a difference in people's lives. I want to make sure they are and stay healthy. I want to treat them the same way I would want my family to be treated, and I felt like I did that in this case. Well, thinking back on the case now, I feel like I could have prompted more questions about the confusion earlier than I did. The wife said she was concerned in the waiting room, and they were out in the waiting room for about 15 minutes before I brought him back into the PACU bay. I wish I would have asked his symptoms out in the waiting room sooner, or maybe had been able to make more of an observation when I was getting him from the waiting room to see how he was acting out there. But I feel like after I had him in the bed for about 5 minutes at most, I was able to see more of his symptoms, and that prompted me to get somebody of higher knowledge, which was anesthesia. Why did this happen? Well, I couldn't have prevented the patient from having AFib, which ended up causing a stroke, but I definitely find that since that encounter, I have been more observant to the way my patients present themselves, how they act. I want to make sure that if anything like that was to ever happen again, I'd be able to alert the surgeon and the anesthesiologist sooner. I also find myself having the patient get changed and put on the vitals sooner than I did previously. I want to see the vitals before I go any further in questioning and IV placement. I'm glad I did call anesthesiologist over and had him talk with the patient and his wife, and then I took it upon myself to start the vitals when we were talking. In this case, it made me feel like a better nurse because now I changed the way I take care of patients out in PACU. I'm more observant, I start vitals quicker than I did previously, and hopefully this helps another patient from having delayed treatment at a higher level of care than the surgery center.